I had been in an office, I was a stenographer, and I was pretty young, but 17 years old, I couldn't think that I wanted to work weekends or study or do shift work. So I tried it, and I'm still doing it 39 years later. But I did go through my LPN, my psych, and then I did my RN, and a few extra courses to build me along the way, and critical care and specialty areas, yeah. So I'm still doing it, and I think I love it more. There are so many rewards. They're not financial, they are more a feeling of accomplishment, seeing lots of human nature, knowing what you're capable of in the worst situations. I feel very compassionate and very passionate about looking after people who are in a very vulnerable situation in their lives. They've lost a lot. You help them transition from being out in the community or in another facility at a time when they are losing lots of things. So you see that, and you see that in their families as well. So if you can help them transition into this place where they will have a lot less, but you can still give them a lot. And what they really need is love, and sometimes a hug, a nice little conversation. And as you work with them, the longer you work with them and the more you get to know about them, you can bring that back into the conversation. It's just like another family member almost, you know. And it's very difficult sometimes with the volume of people we look after to get to know anyone really well. And then one day you're surprised you didn't know that lady could play the piano like that. A lot of the time in long-term care, it's giving enough fluids, looking after skin care and pressure care for those people who don't move so well, and keeping them as healthy as possible and preventing things from happening. And falls in long-term care too are very, very common. We're trying to reduce the number of falls and the injuries from falls. So yeah, it's all education. So those things are always on my mind. And then I start to give out the medications, I do the treatments and the dressings. There's sometimes a lot of contact with the doctors. If you've got a resident who's changing their health status, you need to move into a new gear as far as what you're going to do. So you're still using your assessment skills from the past. And there's a lot of storage in there from all the years of nursing. So you can draw from that, and you can pick things up, and you can probably prevent a lot of things too. And you liaise between the family and the resident for the best outcomes. And those things happen when you develop good relationships with your residents. Quality of care is all the time, yeah. Some days you can't give what you want to because of your workload, because there's so many other external things. But the essence of it should be there all the time. I mean, walking into the room, the way they've got their room set out, something's not right, you put it right for them. It's just the little, tiny little things that do mean a lot. So it's all the time. The needs of a person in long-term care are very, very different from the needs of the average younger person. And most of the time, these people are somewhat healthy when they go in there, but assessment, caring and compassion.
I do appreciate having Jenny as a nurse and as somebody to talk to, because it's nice to have somebody that's looking after you. The compassion's got to be there, and I think to go further, anybody that works in a care home needs to have that compassion. If they don't, and they don't have respect for the person, they shouldn't be working in here.